Hi, I am Jose Marisi Riquelme from Base Kermuan Eco, and today I'll be discussing about the natural and artificial methods of contraception. Natural method is a method of preventing pregnancy without the use of medications or physical devices. These concepts are based on awareness and observation about a woman's body and menstrual cycle. Sexual abstinence or sexual restraint is the practice of refraining from some or all aspects of sexual activity for medical, psychological, legal, social, financial, philosophical, moral, or religious reasons. Abstinence involves either not having the kind of sex that can lead to pregnancy. Advantages and disadvantages of abstinence. It is 100% effective at preventing unwanted pregnancies and STIs. There are no medical or hormonal side effects. It does not cost anything. What is calendar method? Calendar-based methods are various methods of estimating a woman's likelihood of fertility based on a record of the length of menstrual cycles. Various methods are known as the Naus-Ogino method and the Rhythm method. How do we use the calendar method? Before you can use the calendar method, birth control, you need to keep in track of the length of your menstrual cycles for at least 6 periods. You can do it with a regular calendar or with a period tracking app. Advantages of calendar method. They help women become more aware of their cycles and related physiological changes. Women are able to better recognize abnormalities in their menstrual cycles and reproductive system as a result of greater awareness of their bodies. This method is almost cost-free except for basal body thermometer and perhaps a menstrual calendar. It promotes communication and responsibility sharing within couples. Disadvantages of calendar method. They do not protect the couple against sexually transmitted infections. Where appropriate, couple must use condoms or other barriers as well. Couple requires careful observation and training for accurate recording for a few months before they can be used reliably to predict fertile days. It is more difficult but still quite possible with irregular cycles. The coitus interrupt method has high failure rates and puts great stress upon the male partner to remember to remove the penis just before ejaculation. Viable sperm may be present in the fluid that escapes before ejaculation, and sperms may also swim up from just outside the vagina to cause fertilization. What is basal body temperature? The basal body temperature method is fertility awareness-based method. It is a type of natural family planning. Your basal body temperature is your temperature when you are fully at rest. Ovulation may cause slight increase in basal body temperature. Advantages and disadvantages of basal body temperature. It is cheap. It's easy to do at home. There are no health risk or side effect. It is method to confirm ovulation has occurred. What is cervical mucus method? The cervical mucus method is a type of natural family planning, also called the Billings ovulation method. The cervical mucus method is based on careful observation of mucus pattern during your menstrual cycle. Advantages and disadvantages of cervical mucus method. The cervical mucus method is good for determining when you are fertile by using your vaginal discharge as a way you determine where you are in your cycle. One disadvantage is that this method is not always easy to learn without the guidance of your doctor. Taking your cervical mucus for either fertility or contraception is inexpensive and doesn't have any side effects. What is symptothermal method? Symptothermal method, a fertility awareness method used to predict when a woman might be fertile. The method uses body temperature and other signs and symptoms, not ovulation. Advantages and disadvantages of symptothermal method. The symptothermal method has a significant advantage and effective because it combines the calendar, cervical mucus, and temperature methods. Disadvantages of the method are the intercourse must be restricted to only 7 to 13 days of the cycle. Women must take their temperature daily. The method cannot be used during fever episode, and the method is inappropriate for use lactation or near menopause. This method are associated with side effects, particularly in combination with other medications and tobacco and health complications, including mood changes, acne, headaches, breast tenderness, pelvic pain, excessive bleeding, amenorrhea, nausea, weight gain, and uncommonly blood clots. What is ovulation detection? An ovulation home test is used by women. It helps to determine the time in the menstruation cycle when getting pregnant is most likely. The test detects a rise in luteinizing hormone in the urine. A rise in this hormone signals the ovary to release the egg. Advantages and disadvantages of ovulation detection. Ovulation test kit may be beneficial if you have slightly irregular periods or find other methods of tracking your fertility difficult or unreliable. Disadvantage: ovulation test kits can be expensive and there are no guarantees. Coitus interruptus. Coitus interruptus, also known as withdrawal. It is a traditional family planning method in which a man completely removes his penis from the vagina and away from the external genitalia of the female partner before he ejaculates. Advantages and disadvantages of coitus interruptus. Coitus interruptus, or withdrawal as a contraceptive technique, does not make use of artificial devices. However, it does have several disadvantages. Men discharge a small amount of semen before ejaculation. Men withdraw their penis late and inseminate the female, and side effects include loss of sexual interest, limited arousal and pleasure from foreplay, impotency, development of defense mechanism, body pain, and difficulty in urinating. And now, let's proceed to the artificial method of contraception. Contraception is the intentional prevention of conception by artificial or natural means. Artificial method in common use include preventing the sperm from reaching the ovum, using condom, diaphragm, and etc., inhibiting ovulation using oral contraception pills, preventing implantation using intrauterine device, killing the sperm using spermicide, and preventing the sperm entering the seminal fluid by vasectomy. Natural method includes the rhythm method and coitus interruptus. Compare birth control and family planning. Oral contraception. Oral contraception are also called as birth control pills and are a safe and reliable option for preventing unwanted pregnancy. Oral contraceptives are usually prescribed for 4 weeks at a time, with each 4 weeks packet containing 4 to 7 days of hormone-free pills. Advantages and disadvantages of oral contraceptive pills. It does not interrupt sex. It usually makes your bleeds regular, lighter, and less painful. It reduces your risk of cancer of the ovaries, womb, and colon. It can reduce symptoms of PMS. The most adverse effect of combined oral contraceptive pill is breakthrough bleeding. Women will also complain about nausea, headache, abdominal cramping, breast tenderness, and increased vaginal discharge or decreased libido. Side effects of oral contraceptive. Side effects of oral contraceptives vary depending on the pill's hormone levels and types. Some includes vaginal spotting and abnormal bleeding, breast tenderness, bloating, and nausea. Transdermal patch. The transdermal contraceptive patch is a safe and convenient birth control method that works really well if you always use it correctly. How to use it? You wear the patch on certain parts of your body, and it releases hormone through your skin that prevent pregnancy. Advantages and disadvantages of transdermal patch. The hormone from the patch aren't absorbed by the stomach, so it still works if you're sick. It can make your period more regular, lighter, and less painful. It can help with premenstrual symptoms. It may reduce the risk of ovarian, womb, and bowel. Side effect of transdermal patch: an increased risk of blood clotting problems, heart attack, stroke, liver cancer, gallbladder disease, and high blood pressure. Breakthrough bleeding or spotting, skin irritation. Vaginal ring. Vaginal ring are polymeric drug delivery devices designed to provide controlled release of drugs for intravaginal administration over extended period of time. The ring is inserted into the vagina and provides contraception protection. Vaginal rings comes in size and fit most women. How to use the vaginal ring? Squeeze the ring and insert into the vagina, likely inserting a tampon. It stays in your vagina for 3 weeks. You then take it out and throw it away and wait 7 days before inserting a new ring again. The ring may ease premenstrual symptoms and bleeding will probably be lighter and less painful. You may not feel comfortable inserting or removing it from your vagina. You can have spotting and bleeding in the first few months. Side effects of vaginal ring. Side effects might be temporary, such as increased vaginal discharge, headaches, nausea, breast tenderness, and mood changes. Subdermal implant. A subdermal implant refers to a body modification that is placed underneath the skin, therefore allowing the body to heal over the implant and creating a raised design. Such implants fall under the broad category of body modification. Many subdermal implants are made out of silicone, either carved or mold injected. How to use the subdermal implant? It is inserted beneath the skin of upper arm. The implant releases a progestational hormone to prevent sperm from reaching the egg. Advantages and disadvantages of subdermal implant. The advantage of subdermal includes long-term contraceptive action without requiring the user's or provider's attention, low dose of highly effective contraception without the use of estrogen, and fertility is readily reversible after the removal of implants. The disadvantages of side effects of subdermal implants includes temporary side effects during the first few months, like headaches, nausea, breast tenderness, and mood swings. Period may be irregular or stop altogether. Acne might get worse. Hormonal injection. The hormonal injection prevents pregnancy by injecting a synthetic version of the hormone progesterone called dipomedroxyprogesterone acetate or DMPA. The injection, also called DIPO. DIPO prevents the body from producing its own hormone and releasing eggs from the ovaries. How to use the hormonal injection? A doctor or nurse will inject DIPO into the muscle tissue in your arm or bottom. For continued contraceptive protection, this should be repeated every 12 to 14 weeks. Advantages and disadvantages of hormonal injections. It does not interrupt sex. It's not affected by other medicines. It may reduce heavy, painful periods and help with premenstrual symptoms for some women. Your period might become irregular. Side effects of hormonal injections. Users may experience headaches, acne, hair loss, decreased sex drive, and mood swings. Side effects can continue for as long as the injection lasts, 8 or 13 weeks, and for some time after. Interactive device. An interactive device, also known as intrauterine contraceptive device or CODE, is a small often T-shaped birth control device that is inserted into the uterus to prevent pregnancy. IVDS are one form of long-acting reversible birth control. How to use the interactive device? The doctor will put the IVD in a small tube that they will move the tube up through the cervix and into the uterus. Then they will push the IVD out of the tube and pull the tube out. Strings attached to the IVD will hang 1 to 2 inches into the vagina. Advantages, disadvantages, and side effects of intrauterine device. It protects against pregnancy for 5 to 10 years, depending on the type. Once an IVD is fitted, it works straight away. There's no hormonal side effects such as acne, headaches, or breast tenderness. It does not interrupt sex. It's not affected by other medicines. Most people who stop using an IVD do so because of vaginal bleeding and pain, although these side effects are uncommon. Chemical barriers. Chemical barriers or spermicides are sperm-killing substances available as foam, creams, gels, films, or suppositories, which are often used in female contraception in conjunction with mechanical barriers and other devices. Spermicides are usually available without a prescription or medical examination. Advantages and disadvantages of mechanical barriers. It's available and affordable. It can prevent the spread of STDs when used properly. Effectiveness as a contraceptive is compromised when the barrier is damaged or not used properly. Diaphragm. This is a rubber or silicone dome with a firm, flexible rim. It fits inside the woman's vagina and covers the opening of the uterus, called the cervix. A diaphragm is always used with spermicide. A woman puts a diaphragm no more than 6 hours before she has sex. The side effects of diaphragm. A diaphragm may be a good option for a young woman who can take responsibility for protection before having sex, but there are also effects of using it. Effects may include irritation of the vagina and surrounding skin, or an allergic reaction. Strong odor of vaginal discharge is the diaphragm left in too long. Higher risk for urinary tract infection or UTI. Toxic shock syndrome. Diaphragm does not protect against STDs. Cervical cup. It is a rubber device and it fits inside the vagina, right up against the cervix. The cervical cup is always used with spermicide. You need a doctor prescription to get a cervical cup. After 1 year, 16 out of 100 women who use cervical cup and who have not a vaginal delivery will get pregnant. Out of 100 women who had vaginal delivery, 32 will get pregnant after 1 year. A cervical cup can last for up to 2 years. Advantages, disadvantages, and side effects of cervical cup. It is reusable and relatively inexpensive, small and easy to carry, requires less spermicide than a diaphragm, and are hormone-free, but it also requires consistent use for each sexual intercourse. Spermicide may be messy, and prescription is required. Side effects include irritation of vaginal discharge. Male condoms. It is a thin tube that fits over the penis. Condoms can be made of rubber, plastic, or lambskin. They prevent sperms from getting into the vagina. Rubber and plastic condoms is placed over the erect penis right before sex. A new condom must be used each time they have sex. Condoms have no side effects. Advantages and disadvantages of male condom. Prevent pregnancy. Cheap and convenient. Effective against STDs. No permanent fertility changes. Latex allergies. Condoms are not foolproof. Female condom. It is thin plastic pouch that is open on the end. The clothes and is placed inside the vagina. The condom lines the walls of the vagina and prevents sperm from getting into the vagina. The female condom also protects against STI. A new condom must be used each time a woman has sex. You can buy a female condom without a doctor's prescription. Advantages and disadvantages of female condom. They are slightly less effective or preventing pregnancy and STIs than male condom. They can be noisy. They cost more than male condom. There's only one side. Surgical methods. Female surgical sterilization is a form of permanent contraception that involves sealing off or blocking a woman's fallopian tubes. It is referred to as tubal ligation or having your tube tied. Advantages, disadvantages, and side effects of surgical method. It is very effective at preventing pregnancy. It considered a permanent method of contraception. It requires a minor surgical procedure. There is a small risk of hematoma and/or infection after the procedure. There is a small risk of hematoma and/or infection after the procedure. Side effects includes infection, bleeding, and accidental damage to nearby organs such as the bowel or bladder. And that could be all. Thank you.